Hi, I'm Dr. Shilpa. Today, let us discuss about IVF and let us try to understand what involves in IVF procedure. So, IVF is in vitro fertilization, which is commonly known as test tube baby. Here, the woman's eggs are retrieved after giving injections over a period of 8 to 10 days from second day onwards. And after retrieval of these oocytes under anesthesia, the eggs or the oocytes that we get, it is fertilized with the husband's sperms in the embryology laboratory, and then the embryos are grown in the laboratory for 3 to 5 days, and we kind of check as to how the growth and the quality of the embryos are, and depending on the quality of the embryos we do the transfer of this embryo into the woman's uterus back on day 3 or day 5. Day 5 is more better, and day 5 is called as blastocyst transfer. So this whole process of IVF takes at least like 14 to 18 days to get over if we do both the egg pickup and also the embryo transfer in the same cycle. So to begin with, the first step is the giving the injections. So ideally the patient has to come on the second or third day of the period. We do a ultrasound scan by vaginal scan, and then we decide on the dosage of the medications that is required for that woman, and we start giving the injections on a daily basis onto her thighs, and this is continued till day 10 or day 12. We do a scan during this time on day 5 and again on day 8 and again on day 10 if required. So once this is done, we give a injection shot called as trigger once the follicles which contains the egg in it reaches around 18 to 20 millimeter in size. So once this trigger shot is given, after 36 hours we schedule the woman for oocyte pickup or the egg pickup or the OPU, what we call, under short general anesthesia in the IVF OT. So on that day, that is, for example, if the woman has taken injection tonight, say around 10 o'clock, then we call her day after tomorrow, that is after 36 hours in the morning at 10 o'clock for the egg pickup. So this is done by ultrasound guidance transvaginally, and we have specialized instruments like needle, suction, everything, which I will be showing it to you, which will be used for the oocyte pickup. So once we get the oocytes are given handed over to the embryologist, and he screens the oocyte about the quality, about the maturity of the oocyte, and then he decides whether IVF, that is in vitro fertilization, where he just puts the sperms in the test tube along with the egg, or whether to do an ICSI. ICSI is intracytoplasmic sperm injection, wherein he injects each sperm into the egg of the woman. So once this is done, the checking of the fertilization happens the subsequent day, and the checking of these embryo quality happens over the next 3 to 5 days. Depending on the quality and the number of the embryos and also other various parameters, we decide on transferring the embryo. So if we decide to do the transfer in the same cycle, which is called as fresh transfer, we decide to do it on day 3 or day 5, and ideally we should put only 2 embryos and not more than that. So doing one embryo transfer is again discussed with the patient depending on the age and the patient's preference, which we decide and go ahead and do the single embryo transfer. So once the embryo transfer is done, then we give supplement medications like progesterone and vitamins and injections like heparin to make sure that the pregnancy is supported, and we ask the patient to do a beta HCG or a pregnancy test on day 14 after the embryo transfer. So with the result, the patient comes back and sees the doctor to know what is the result of this whole process of IVF. So this is what is involved in IVF, and I think we can discuss more about it in the subsequent series, which will give you more insight about this procedure, which is becoming more and more utilized now because of various reasons, and also I think it is one of the popular ways where older women can have a chance of having a pregnancy. Thank you very much.